Historically, we always thought of surgery as elective. You have an issue and you take them to the operating room and you deal with that issue, and it all takes place at the same time. But in damage control, it's not that. You have to change the way you think about time. The best way to think about damage control maybe is with an example. So if you had a patient with a very serious liver injury, they tend to have a lot of blood loss. They may be coagulopathic and acidotic and beginning to get cold as you meet them. When you develop that lethal triad, we call it, then everything else stops working. Your heart stops working as well, your lungs stop working as well, your coagulation gets even worse. And what we used to do in the old days is we would take them up to the OR and we'd start to deal with their liver injury and we'd try to fix it. But what we found is that if you did all that and you got the bleeding stopped, that took time, and they would get more coagulopathic, more acidotic, more cold. They'd have a complete operation, but then they would die from the consequences of that. And so what we do now, instead of doing the whole operation from beginning to end at the same time, we stage it over time. So the first component of a damage control is to stop the bleeding. Then we can take them to the ICU and we can warm them up. We can give them back the blood they've lost and the factors that they've lost to correct their coagulopathy. We can reverse their acidosis. Then we can take them back to the operating room, sometimes the next day, sometimes 12 hours later, take them back and finish up that operation. But then they're not cold, they're not coagulopathic, and they're not acidotic, and everything else is working. And it was something we did with almost all of the patients who were victims of the marathon bombing. They all had staged operations, starting with controlling the bleeding and taking away the dead tissue, bringing them back for more definitive operations, and then finally closing their wounds. But it was all done over time, and our outcomes were great.